It's a Northwest News Radio weekend. IRG's Health Talk continues.
Welcome back. Our next segment features a couple of doctors, Dr. Gina Peterson, an IRG physical therapist, and the doctor of physical therapy, Dr. Andrew Simon, a naturopath. We're talking about cervical pain, and let's kind of, break it down for our listeners exactly what the cervical area encompasses. Shannon, is that the entire spine, the back?
That's a great question. No, Tom, the cervical area of your spine is the neck area. The cervical area, when we talk about the spine, we break it down into 3 or 4 regions. We have the cervical, thoracic, lumbar, and then sacrum. Your cervical region is your neck area, and the neck is built for a lot of mobility. You can turn your neck, you can flex, extend, a lot of mobility in that area. And that mobility sometimes lends itself to maybe some problems such as muscle strains, postural dysfunction. I mean, you can get facet impingement, you can get a disc bulge. It's a very complex area. And those nerves in the neck go down into your arms. So understanding what's going on in your cervical region sometimes help you understand what's going on in your arm. And these two folks are going to talk about collaboration.
All right, Dr. Gina Peterson, Dr. Andrew Simon, and Shannon O'Kelly.
Gina and Dr. Andrew Simon, welcome to Health Talk. How are you?
Doing good, Shannon. How are you?
Doing great. It's very sunny out today.
A very nice day. It's always nice to have a nice day. It's even nicer when I can get providers on and we can talk about collaboration. Dr. Gina Peterson is a physical therapist and Dr. Andrew Simon is a naturopathic physician. And you guys work closely together and collaborate to benefit. Ultimately, what you're trying to do is benefit the patient. Let's talk about maybe, Gina, start just real quick. Maybe tell our listeners your area of focus, your practice, your background, your interest, and then Andrew, I'm going to let you kind of take an opportunity and tell our listeners about your background. Gina, let's start with you.
Okay. So my name is Gina Peterson. I've been a physical therapist for about 5 years. Prior to that, I was a certified exercise physiologist through the American College of Sports Medicine for about 7 years before I was a PT. So I have a lot of experience working with individuals of all ability levels, but in my physical therapy practice, I'm actually a fellow of the American Academy of Orthopedic Manual Physical Therapists, and I'm an instructor for orthopedic residency program in the PT realm, and then also the Swedish family practice physicians do their musculoskeletal rotation with us. And then my areas of interest are really pretty focused to the neck. So cervical spine, upper thoracic spine, interactions with the nervous system with the cervical spine and with the upper thoracic spine in particular. That's an area that I've written about professionally. I have a presentation on T4 syndrome, which is a dysfunction of the nervous system that is also associated with a movement dysfunction at the upper thoracic spine. And then I'm also really interested in neural entrapment, so nerve pain related to nerve compression in the arms.
We're excited to have you. Gina also works at our Seattle Centers for Structural Medicine, does a great job with clinical care and patient care. Dr. Andrew Simon, naturopathic physician, tell us about your background.
I'm actually pretty close to the Center for Structural Medicine in Ballard, and I've been a naturopathic physician for about 8 years, and I run a clinical practice here in Ballard called Rebel Med Northwest. I also teach part-time as adjunct professor over at Bastyr University in the Bastyr Center for Natural Health. And in my time, my undergrad was in exercise science and kind of biomechanics and movement related concerns. So I take that and apply it into a primary care level practice with my patients. Through that time, as a physician, I've also become certified as a biofeedback provider. And I use biofeedback in multiple different ways to help kind of work both with the ergonomics of the body, pain, musculoskeletal medicine, and a lot of mental health concerns that sometimes get in the way with my patients regarding their ability to recover, their ability to get better. And so, it's been really great working with Gina, with me coming from a primary care lens, able to do some hands-on work. I do spinal manipulation care, stretching, basic education patterns. But when I find my patients really need that extra special support, I send them over to Center for Structural Medicine.
That is awesome. You know what I'm finding in today's healthcare world, it is so important that we're all collaborating. All providers, disciplines are collaborating because ultimately what we all want is what's best for the patient. I love the fact that you guys are working together and it sounds very exciting. Let's talk about the cervical spine. Gina and Andrew, you both mentioned it's very complicated. complicated. Personally, as a physical therapist myself, I always enjoyed the cervical spine because it just seems like there's so much mobility. It's so important. You can get things from nerve problems, entrapment, compressions, degeneration. And then on top of this, you get all this cervicogenic headaches, myofasciitis, postural dysfunction, and the world that we live in with so many people working out in front of our body ergonomically, it's challenged. So let's talk about that. Just are you guys excited about the cervical spine? Let's get amped up here.
Oh yeah, for
Ready,
sure.
man. I'm ready.
More with Dr. Peterson, Dr. Simon, and Shannon O'Kelly next on Northwest News Radio.
It's a Northwest News Radio weekend. Here's Tom Hutler and Shannon O'Kelly. This is IRG's Health Talk.
We continue our conversation on cervical pain with Doctors Simon and Peterson, along with Shannon O'Kelly.
Dr. Simon, Gina, thank you so much for joining us on Health Talk. You did a great job by talking about kind of what you do, what your focus is, your background, your training. Let's talk about a scenario. I'm a patient and I have cervical pain. Let's work it up. Let's find out what's going on. I'm going to show up I'm going to go to see Dr. Simon.
Yeah, when I meet these patients, I look at a whole person approach when I take that first step. I look at the initial injury or chronic injury side of what's going on, and I try to determine what are the interfering factors that are getting in the way. And, my biggest thing where I work with my patients is in that whole body approach to their calming their nervous system, teaching them about their body, their anatomy, helping them understand their injury in the first place, and particularly with the neck, how pivotal that is to other areas of their body, how their arms. Everybody's working from home these days, and they may have to change that up a little bit. So I work on all those other layers there to help with the emotional tension, work with their employer to make sure that they're getting the right time off of work so that way they can get the care they really need.
They're going to assess the problem, do a bunch of education, which I love, but more importantly, you're going to recognize maybe a need to send to someone like Gina, who is a physical therapist and is going to do a bunch of exercise and intervention. So Gina, let's talk about how you guys collaborate.
Yeah, so one thing that's really important to both of us is respiratory mechanics. So when folks are stressed out, they breathe with their necks. They use the neck muscles to elevate the rib cage instead of using the diaphragm to, get a good full expansion of the whole thorax. You can imagine breathing with your little tiny neck muscles that are roughly the width of a finger is much less efficient than breathing with your full complement of respiratory muscles, including your diaphragm, which is much bigger than your neck muscles. So that's something that both Dr. Simon and I work on, is normalizing respiration patterns. And for me, as the movement person, I want to make sure that those neck muscles are not overworking so that I can train them to do the postural function they want to do. At the same time, one of the things that we got to think about is the evolutionary biology perspective. So when I'm scanning the environment for threats, when I'm looking for predators, my neck muscles are tight. They have increased tone at rest, increased contraction at rest. So that also alters the sensory information, the stretch information that they pass to my brain. And that information might not match with the information my eyes are passing or my inner ear is passing, which can lead to all kinds of dizziness, balance dysfunction, all this stuff that's really distressing to patients. And so it really starts with respiration. It progresses to sensory system integration, and then finally to global movement patterns using the eyes, the neck, and the whole body with specially applied resistance to move the body through space with input from all of those systems.
You're a real team. I mean, and you got two different disciplines here. You have a naturopathic physician and a physical therapist, and your focus is kind of the whole body approach. But the communication that you guys are sharing is phenomenal.
Well, the easiest thing in my office a lot through digital is we just try to put as much content into our referrals. So that holistic intake that we take, we try to get as much information as possible. More is better. And that's where that communication our patients really like to have.
Right.
That's the beauty of it. If we can communicate and collaborate, again, ultimately the patient succeeds and the outcome is way better. Can I ask you, can we have you guys come back on down the road so we can continue to dialogue? I enjoyed it so much. I want to have both of you on again.
Oh, for sure.
Yeah, absolutely. I'd love to.
Sounds good. Thank you so much.
Thank you.
All right. Thanks, Shannon.
Very interesting learning about cervical pain, Shannon, as you mentioned, the neck area there. And for those of us who've gone through something like that, it's definitely painful. And if not treated, it can be really painful.
Yeah, it's interesting, Tom. I've probably known 4 or 5 people in the last 2 weeks that have come to me and said, I've got this neck pain. And with a lot of people working from home, maybe in not such a good ergonomic fashion, because their desk at home maybe is not set up properly. And at IRG, we take care of that. We take care of your neck, your whole body.
We could be back with our next guest right after this time out on Northwest News Radio.